Victorians awaking to the toughest lockdown measures in the country this morning, with thousands of businesses shut down and permits required to travel across the city or send children to childcare. Restrictions on Melbourne businesses came into effect at midnight after Victoria recorded Australia's worst day yet of the coronavirus pandemic, 725 new cases and 15 deaths.
This morning, there are warnings about food supplies not just in Victoria but right across the country, and also concerns that Victoria's hospital capacity could run low. And there is confusion about how the new rules around construction sites, abattoirs and childcare will actually work in practice. Let's take you straight to Zali Karismal, who's in a very empty Bourke Street Mall in Melbourne CBD. Zali, good morning. This lockdown is having immediate effects on so many businesses in Melbourne.
That's right, a very eerie morning really in Melbourne. Quite a beautiful morning to wake up to, but a very different Melbourne as of midnight last night. Regional Victoria back in stage 3 and Melbourne in stage 4 for the first time. Thousands of businesses ordered to shut their doors. Now that will impact around 250,000 workers who will be stood down or told to stay home during the next 6 weeks. Now the closures will affect most retailers, except those essential services such as grocery stores, supermarkets, pharmacies, banks. Also, some stores will still be able to open, such as hardware stores, but they won't be able to open to the public, just to tradespeople. Now, in addition to those industries that are going to be shut right down, there are others that are being scaled back. So that includes construction and meatworks. Now, that means they'll be running at reduced capacity with workers to be limited to one site only. Now, there are concerns today about how these shutdowns may affect supply chains, and in particular food supply chains, even nationally. We know that the Treasurer, Victorian Treasurer Tim Pallas, held urgent talks last night with industry groups, hashing out some of these details, some of the concerns about, in particular, how, for example, distribution centres that supply supermarkets, how they will be continuing to keep up with demand in this period when they have to run at that reduced capacity. But for workers who are still able to come into work, we do now need to carry a permit. Now, I just had my permit with me earlier and I've managed to lose it, so hopefully I'll find that very soon. But I did have to, I had that on me this morning as I was leaving home during curfew still before 5 a.m. Quite a strange feeling and a very different morning in Melbourne today.
I'm sure police officers there will give you a punitive grace if they come across you, Zali, without the papers. Hey, let's go to the changes in the state's childcare system. They come into effect this morning, but there's still so much confusion about who is eligible and who isn't.
That's right, a lot of confusion still around this morning. Now, in addition to worker permits, people who are still able to access childcare will also have to have a permit from the government. Now, childcare will be very limited only to vulnerable children and to kids of permitted workers where no one else is available to care for those children. But just what is considered a permanent worker is still quite a lot of confusion around that issue this morning, but we do know that those permits can be accessed via government websites, that employers will have to attest that their workers are in those permitted categories, but we'll still see, no doubt, just how that's going to work out on the ground.
And Zali, finally, growing concerns around hospital capacity, especially in the wake of those record numbers yesterday.
That's right, a staggering day yesterday for Victoria with 725 new cases and 15 new deaths, a record on both fronts. Now, there are concerns that hospitals may not have enough capacity in the weeks ahead, particularly if those numbers don't start to drop. We've currently got 538 people in hospital, 42 of those in intensive care. And there are particular concerns around the aged care clusters. We know there are 1,500 cases linked to those settings. 250 of yesterday's new cases alone were linked to those settings. And so obviously many of those residents are having to be transferred to hospital. In fact, we found out yesterday that around 300 residents have been moved, many of those for infection purposes rather than because of the severity of their symptoms. But when asked when the Deputy Chief Health Officer, Alan Cheng, yesterday was asked about that capacity moving forward, how sustainable it was to be moving so many people into hospital, he did say that there was a limit to that. There are also concerns about healthcare workers, with more than 1,100 having contracted the virus so far, and no doubt that will continue to be a concern. The government at this stage still saying that there is extra capacity, that extra capacity has been built into the system exactly for this situation. Hopefully that won't be necessary to be used.
Hopefully not. Zali Rismail in Melbourne CBD, thank you so much for the update there.
New South Wales is bringing in tougher measures to control travel from Victoria, forcing anyone who arrives from the state into hotel quarantine for 14 days from midnight tonight. There are continued cases of people trying to sneak into the state, with a 27-year-old man allegedly in a stolen ute, the latest to be charged, and a Newcastle student has tested positive for COVID-19, prompting the closure of a local high school and forcing 2 soccer teams into self-isolation. New South Wales Health Minister Brad Hazzard has told News Breakfast the message to Victorians is clear.
Well, basically what we're saying to Victorians is outside the border zone, don't come to New South Wales. Look, it's terrible. I think New South Wales at the moment is doing very well.
The global death toll from the virus has surpassed 700,000, with the US, Brazil and India still leading the rise in fatalities. It has taken just 19 days for the latest 100,000 deaths to be recorded, but the numbers could be much higher due to unreported cases. In Norway, a cruise ship carrying more than 200 people has been ordered to keep everyone on board after a passenger from a previous trip tested positive. And in New York City, they'll be setting up checkpoints there to ensure travellers coming in from 35 other states comply with mandatory quarantine. A tourist has allegedly been caught sneaking into Uluru National Park after flying through a coronavirus hotspot. The woman was among almost 40 visitors who arrived from Brisbane on Monday and were blocked from entering the park by Indigenous residents. It's alleged the woman secretly entered the park through an official entry point. She was later found by rangers after injuring her ankle.